Welcome back. Dr. Thomas Earl is a cardiologist at Northern Light Eastern Maine Medical Center. He is here to talk with us about February being American Heart Month. Thank you so much for coming in.
Thank you.
As a doctor, how does one go about diagnosing that someone may have heart disease?
Yeah, so it's a great question. So that usually starts with a relationship with your primary care provider, going in for regular histories and physicals. At a certain age, that's usually followed by things like ECGs, and based on the history that a patient gives, findings on a physical exam, that oftentimes may lead to further testing like echocardiograms or ultrasound pictures of the chest, stress tests, CAT scans, MRI pictures, even invasive procedures that may diagnose heart disease.
Somebody finds out that they have a heart disease, what are the first steps they should be taking?
So first steps is developing a relationship with a cardiologist to both explain the diagnosis, do more diagnostic workup if needed, and then formulate a treatment plan based on the patient's wishes and goals.
As I've gotten a little older, I've learned a little bit about atrial fibrillation. People also call it AFib. Can you tell us a little bit about what AFib is?
Sure. So atrial fibrillation, broadly speaking, is an abnormal heart rhythm. It's by far the most common abnormal heart rhythm we see. Probably 5 million people in this country have atrial fibrillation. We see it more commonly as we age. So as our population gets older, we're going to see more and more of this. Patients can oftentimes have a sensation of palpitations or an irregular heart rhythm. Most concerningly, atrial fibrillation can predispose people to stroke. So diagnosing it, recognizing it, and treating it is important.
As people have become more aware of it, technologies advance, and the way it can be treated, including at Eastern Maine Medical Center, have advanced as well. Is that correct?
That's correct. So, the long-standing treatment for atrial fibrillation has been slowing the heart rate down if the heart is in fact rapid. But more recently, we've developed medications that can help keep people out of atrial fibrillation, and even more durably, we can offer patients catheter-based procedures to cure the atrial fibrillation.
If you want to learn more, it's northernlighthealth.org/hearthealth. Thank you so much for coming in. But I go back to the first thing you said, which is having a relationship with a doctor and making sure you're taking care of yourself and not letting it go too far before you just get somebody who knows what they're talking about looking at you.
That's right. That's critically important. With a lot of things in medicine, cardiology in particular, recognizing it early is key. That gives us the best opportunity to treat it definitively.
Yeah. You know what? We schedule those annual physicals for a reason.
That's right.
Go get them done. Thank you so much for coming in. Northern Light Heart Health, northernlighthealth.org/hearthealth. Back with more right after.